So if a person is wearing a denture,
Yes.
and they want a brand new set of teeth with dental implants, what's that process like, and what are their options in your practice?
Well, you have several options. You could have 2 dental implants placed, for example, for a lower denture, if you just want to hook it down and make sure that lower dentures want to jump out of the mouth, usually, because it's just a piece of plastic floating on something. Every time the tongue moves, the denture wants to pop out of the mouth. And so we can just use 2 implants, like 2 anchors on a boat, to kind of stabilize it. There might still be some rocking freedom, but you're not going to have to worry about your teeth popping out as you eat. Now, if you want to take it a step further, we could place 4 implants. And that really, it's like a table, you can imagine. It's much more stable. So now it won't rock anymore. Likely you will be able to eat corn on the cob and your ribs or wings, and things like that, where you have to really incise a lot. And on the upper arch, when you have an upper full denture with the 4 implants.
But isn't the upper okay because of the suction?
Well, yeah, if you like to have this big thing in your mouth that covers your entire palate, yes, some people get reasonable suction, so it doesn't fall down. But the problem is with this palate covered, you can't taste your food very well. There's a lot of feedback from the palate, not just the taste, but also the texture, you know, chunky versus smooth, and the temperature. And so it's really nice to not have the palate covered. That's what bothers people. Some people gag with the palate covered.
So for a denture wearer, you could just give them new teeth up there, no palate covered,
and
they don't come out.
Right. And often I can actually work with the denture that they have, so they don't even have to buy a new denture. Sometimes they choose to because the one they have doesn't fit as well, or it doesn't look as nice, and they're just ready for a whole new set of teeth. But often I don't have to. So if we get 4 good implants in on the top, we can cut that palate out. Now you could take it one step further even, where you can't take your teeth out anymore. So what that means is we place at least 4, sometimes 5 or 6 implants, and then we make a bridge on top of them. So we
like
connect
a full arch of teeth on the bottom.
That's right. And it just screws in place, and you can't take them out. You brush them like your natural teeth, and
what could they eat?
Anything they want.
I mean, do you have to be careful, like with a raw carrot, like with your front teeth, when they're all healed up?
Personally, I wouldn't take a big, thick raw carrot with my natural teeth and bite it in the front. But you can eat anything that you can really eat with your natural teeth. There are no restrictions. There are in the beginning when you're healing from the procedure, but after a healing time, once the implants are really integrated, then you can eat anything you want.
So these people that you take from a denture now to brand new teeth that don't come in and out, what do they like the most? The way it looks, or what they could eat?
Oh, I think both. And they might come in with a motivation to do one and then realize the benefits of the other later. You might have the person that says, hey, all I want to do is eat. And then they get this new set of teeth that they really like, and they're like, wow, I had no idea how much I would like this new smile. Same way the other way around. You might have somebody who's really motivated by the way they look, and they don't think that they care much, but now all of a sudden they get a good set of teeth that doesn't just look good, but it eats well, and now they're starting to make different diet choices, they're getting healthier, and they love their smile, so they want to look their best, so they're starting to work out again, and really some re-enter the dating circuit, so it is really life-changing on both aspects, really.